This is a true statement, is it not, that you were the primary investigator of the Sargon animal study entitled Histomorphometric Analysis of Immediately Placed and Loaded Implants?
Yes.
This is also a true and accurate statement when you say that in our study conducted at Indiana University, we had some inherent problems in conducting the study, right?
Yes.
The animal model posed some problems in the placement of the implant, and we had to exclude one animal from the study. And as we've discussed, that's also correct, right?
Correct.
You continue, quote, "We did, however, find that the bone contact, bone formation rates, and mineral apposition rates within 1 millimeter of the implant surface are within the ranges of other implants." That was true when you wrote it, and it remains true to the best of your belief today, correct?
Correct.
Now, you then continue on, and I'm going to read this because we only have one copy. You say in the next paragraph, and I'll read the whole paragraph into the record, "I have used this implant in my practice, period. To date, I have 5 Sargon implants placed, period. The number is not significant. However, the cases are, period. The most striking case is that of a female client with a very high smile line requiring the extraction of the maxillary right central incisor, period. This was very traumatic to the client, period. She consented to implant treatment with the Sargon implant because of the ability to place and temporize the implant immediately, period. Obviously, this was an aesthetic concern for the client, period. To the point that she was the one to point out that the gingival contour was maintained throughout treatment, period." Excuse me. "The patient was so pleased she has become one of my best referral sources, period." That's all information that you wrote and communicated to Sargon Lazaroff at the time that you sent this undated letter, correct?
Correct.
And was that all true when you wrote it?
Yes.
And does that remain true as you sit here today?
Yes.
We have remarked Exhibit 9 as a 2-page document that's dates labeled 50574 and 50575, and it's entitled Biological Evaluation. And I've had a chance only very briefly to show opposing counsel this, but what I'd like to do is show it to you, and then I'm going to take it back and ask you a question about it, okay? So if you could just take a moment to familiarize yourself briefly with that document. Sir. Is this an accurate statement, sir, that their investigation, which intends to reference the bone study that you conducted, the dog study that you conducted, quote, showed that new bone forms on the surface of the Sargon implant, comma, and that a fibrous layer is not present?
Right.
Is it also true, as this writing goes on to say, quote, the surface area that is actually osseo-integrated may be much greater than the 30% that is usually seen with conventional implants due to the internal surfaces of the 5 quote-unquote legs becoming osseo-integrated, parentheses, the expansion screw itself becomes the 5th quote-unquote leg, end parentheses. Is that also a true statement?
Of the bone contact being greater than 30% through our Doug study, yes.
Do you recollect providing slides or images on a disc to
Yes.
Dr. Lazaroff?
Yes.
And it's going to be very tough for you to see what the images are here, but what I want to ask you is, with these in front of you, looking at the descriptions that are underneath the pictures, and to the extent it's possible, looking at the pictures themselves, if those are images that you had sent to Dr. Lazaroff.
Yes.
So is it fair to say then that those are images that were generated in the course of the study that you presided over?
Yes.
Thank you. Let's now mark as Exhibit 10 what I had initially marked as 9, being the USC study report. Scratch that, being the 4-page document by Dr. Garfield called The Immediate Loading of Individual Freestanding Implants in Fresh Extraction Sites, a clinical report on the Sargon system.
Have you marked that?
That's Exhibit 10. And I'm going to give this copy to you, Doctor. I think I gave you back the others. Let me grab one more from you.
You should mark that, right?
Yeah. I'm going to mark this copy for you. And I only want to discuss the second to last paragraph on the second page, which is Bates labeled USC 5379. Let's go about halfway into that. I want to ask you if it's fair to say that the study that you conducted, Doctor, indicates, now I'm going to pick up with 6 lines from the bottom, 5 lines, quote, that the bone density increases around the implant after several months of function.
Where's that again? Show me. Can you
Sure.
show me that exactly?
Right here, indicate.
Okay, thank you.
So I want to ask you, just again, whether it's an accurate statement that the results of your study indicated that with the use of the Sargon implant, the bone density increases around the implant after several months of function.
Yes, it had that oscillating effect.
And then with respect to the next sentence, it states, it is hypothesized that this phenomenon, bless you, is due to reparative bone formation induced by the microfracturing of the trabecular walls upon expansion of the implant within the cancellous bone. Is that a statement that you understand, first of all? And second of all, is that a statement you would agree with?
Yes.
Yes as to both of those?
Yes to both of them.
And then it continues, additionally, immediate function may promote bone growth. Is that also a statement you would agree with?
Yes.